Faith Yoga for TMJ. What is TMJ? Temporomandibular Syndrome. Pain associated with this big muscle right here that comes all the way down to your jaw. Sometimes at night we bite in our sleep and we can't help it. It happens when we're all stressed out. Has it happened to you? And we wake up in the morning with pain and we can't open our mouth very well. And sometimes we are prescribed medication for it, but that's not enough. So I'm gonna show you how with Faith Yoga you can relieve that pain. And first, who is not going to do these movements? If you had facial surgery recently, you're not gonna do this. Also, if your jaw dislocates easily, you're not gonna do this. If you have osteoporosis, you're not gonna do this. If you have any doubt, you consult your physician first. So first, this bad boy here, the temporalis muscle, look how big it is, and it goes down all the way to your jaw. What does it do? When it contracts, it closes your mandible, and it aids in mastication, in eating, yum, 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 yum. And together with this other muscle called masseter, we eat our yummy food. But sometimes at night when we're stressed, we clench our jaw, and then in the morning we feel pain, and that pain can be reflected to all the head, to our eye, and we can even have migraines. So let's do some stuff to relieve it. And if you're new here, I'm Dory, ER physician, Faith Yoga instructor. If you like content like this, follow for more. First, we're gonna take a deep breath. Relax and imagine that we're really, really tall. Then we're gonna start tapping just lightly our head all the way to the back, and our forehead, our temporal area, which is the side of the head, which is what we're gonna be working on, and lightly, just very lightly, in the side of our cheeks and our jaw. Okay, that's it. That's it. Now, and we're going to take another deep breath. Now, you're going to take this area of your hand and you're going to put it in your temporal side, and you're going to do some circles. Just a light pressure. You can rest your fingers in your head, just big circles, big circles. Take a deep breath, relax your shoulders, just a couple of deep circles. And to the other side, take a deep breath, relax your shoulders, just a deep circles. Okay, that's it. Okay, now we're gonna take this side of our fingers and we're gonna drag the fingers along the line of the muscles. Just drag them. That's it. Just downwards. Just a couple of times. Drag just a couple of times. And as you're dragging them, I want you to observe. You can do it with your fingers too. You can run your fingers and you're going to observe if there's any area that is a little bit stressful. You can even do it with one finger. If there's any area that you're finding where the muscle is a little bit hard, I find an area here and I want you to see this. Let me grab a mirror. Look at this. Do you see it? When I bite, the muscle bulging is very hard, like here. So I'm gonna take a pencil and I'm gonna put it there, and I'm just gonna take the pencil and just slightly with the eraser side, I sanitize this pencil with a little bit of hand sanitizer just prior, and I'm gonna just apply, this is like acupressure, just a little bit of pressure for about 30 seconds. Okay, now that I applied the pressure, I try to find any more points along the line, and you're looking along the line of the masseter that I just showed you, and you can do the same in the head. You can do this the same in the temporal area, and you can do like a mini acupressure in the area and relieve those tension points. You're just gonna apply just a little bit of pressure. I don't want you pressing too much. If you're a patient of hydrocephalia, you're not gonna do this. I don't want you putting pressure like maybe on your valve in your system. I don't want you doing any of that. If you've had cranial surgeries, I don't want you doing that. You know, some patients are more delicate than others. So, you know who you are. You can also clench your teeth and find those areas of pressure that are bothering you. And after this, you're gonna tap again, just a slight pressure in the areas that you worked. You take another deep breath, in and out, and that's it. And remember, any pain in your head, your face, or your teeth always needs to be checked out with your doctor and with your dentist. Thank you.